Inspire hope, promote wellness. This is Compass Points. Hi, this is Dr. Paul Tomlinson from Compass Health Network. On this show, I'll share ideas, hacks, tips, and skills drawn from research in the behavioral and health sciences. You can think of Compass Points as navigation assistance for the path to better health and wellness. So let's get to the Compass Point.
We humans are wired for connection. Our brains and bodies are built to seek safety, acceptance, and a sense of belonging. And when we experience love and connection, something remarkable happens. We don't just feel better emotionally. Our biology actually changes. Stress hormones decrease. The nervous system settles. Healing becomes much more possible. Seemed like February is a good time to talk about all this. Valentine's Day is everywhere this month. Cards and candies, commercials and messages celebrating romance and partnership. And for many people, that can be joyful and affirming and a lot of fun. But for others, February can quietly amplify something much harder: loneliness, grief, or the very absence of the relationship they wish they had. Both experiences are very real, and both matter when we talk about mental health. Our recent needs assessment reinforces what research has shown for decades. Social connection is one of the strongest protective factors for mental health, period. Feeling seen, valued, and connected lowers the risk of depression, anxiety, substance use, and even early mortality. Yes, early mortality. Loneliness, on the other hand, is not just an uncomfortable feeling, it's a serious health risk. Chronic isolation increases stress, worsens physical health, and raises the risk of suicidal thoughts and behaviors. And loneliness doesn't always mean being physically alone. You can be surrounded by people and still feel deeply disconnected. In many rural and small-town communities, social connection can be both a strength and a challenge. On one hand, people often know each other, show up for each other, and maintain deep ties across families and across generations. On the other hand, stigma and fear of being judged can make it hard to say, I'm not okay. And it can make walking into a counseling office, a mental health center, or asking for help at all feel risky and exposing. That tension matters because connection only protects us when it's safe and genuine. Love shows up in many forms, not just romantic ones, though. I think it's important to remember. It might be a partner who listens without trying to fix everything, a neighbor who checks in, a teacher who sees potential in a struggling student, a coach, a coworker, a faith community, or a friend who creates space for honesty rather than judgment. Each of these relationships sends a powerful message to the nervous system. You're not alone. You matter. You're safe enough to keep going. And often, it's the small gestures that carry the most weight. A text that says, thinking about you, an invitation for a cup of coffee, a hug offered on a hard day, someone remembering your name for goodness sake, or remembering your story. These moments don't solve problems all by themselves, but they tether people to life and to possibility. They interrupt isolation. They remind someone that they're still connected to the world, even when things feel awful heavy. For children and teens, research is especially clear. Even one stable, caring adult can dramatically lower suicide risk. For adults, friendships and community ties are just as important as medical care in many ways. Connection isn't just a nice extra thing. It's once again foundational. And it's worth saying this clearly, this month especially. Love and belonging are not substitutes for therapy, medication, or crisis services, but they amplify and enhance their effectiveness, without question. Connection strengthens recovery. It makes treatment more sustainable. It helps people stay engaged when things get really hard. So as we move through February, surrounded by messages about love, it's worth broadening the definition. Love isn't just about romance. It's about presence. It's about noticing. It's about choosing to care. Sometimes quietly, sometimes imperfectly, but consistently. As we work to improve behavioral health services in our communities, let's remember this. Every relationship is an intervention. Every act of genuine care nudges someone toward healing. And sometimes, the most powerful Valentine's message isn't a card or a gift. It's simply letting someone know they're not alone.